Hi, my name is Courtney Kimball, and I'm a registered nurse that works in an inpatient rehabilitation unit. Today, I will be talking to you about my research proposal for my class at Davis and Elkins College in the Integrated Concepts in Nursing class. The program that I have together today encompasses a large amount of information that I'll be collecting specifically on how sleep impacts therapy outcomes in the rehabilitation unit. So, I'll be giving you some key terms, background on why I chose the project, and we'll cover how I'll be collecting the information as well as look over the questionnaire I designed. Before we begin, I'm going to define a few key terms so that when the term is used, there is a clear understanding of what is being presented. Sleep, that is defined by the Oxford Dictionary, is a state of mind and body that recurs for several hours every night. The amount and quality of sleep will be observed to determine if sleep directly affects participation in therapy. The Oxford Dictionary also defines therapy as the treatment of disease or disorders, or by some remedial, rehabilitative, or curative process. We're going to look at specific therapies of speech therapy, physical, and occupational therapy, as well as how the patient is learning and progressing in their therapies. The Merriam-Webster Dictionary defines rehabilitation as the physical restoration of a sick or disabled person by the therapeutic measures and re-education to participation in the activities of a normal life within the limitations of the person's physical disabilities. We're going to assess the patient's amount of time that is spent in their therapy sessions. So why is there a need for a research proposal on sleep impacting therapy? Rehabilitation is important for many patients that are admitted to the hospital after a severe medical illness or surgical procedure. The main focus during the often short amount of time that is spent in physical therapy is to make sure that the patient is safe to be discharged back to their own home or their facility in which they came from. During their stay at the acute rehabilitation facility, the patients are scheduled several hours of time during the day for their speech, occupational, and physical therapy, and depending on the complexity of their diagnosis. Many times prior to, during, and after therapy, patients complain of fatigue and that they did not sleep well the night before. The hospital has its own way of collecting information from the patients, and that is known as the Consumer Assessment of Healthcare Providers and Systems Report, or HCAPS. The scores collected at our hospital showed that the patients are complaining of not being able to sleep at night. So, is the quality and amount of sleep directly affecting how the patients are participating in their therapy? The topic of this impact of sleep on rehabilitation patients has intrigued the minds of staff since beginning to work on the unit. It is evident to some of the nursing staff and the physical therapists. The patients do not concentrate well or perform their best without a certain amount of rest. The recent HCAP scores showed that multiple patients have complained that they did not sleep well, and lots of times those patients did not participate in their therapy to the fullest. Also, it is noted that some of the education that was given to the patients, whether it was on their medications or the steps of rising from the bed to the chair or to a walker, it wasn't being retained. So when they cannot retain what is being presented to them as education because they're reporting to staff they're exhausted, how are the patients to reach their goals? Why exactly is this a problem? The research collected on the impact of sleep on therapy outcomes in rehabilitation patients focuses on the patients admitted to the acute rehabilitation unit. The problem with sleep exists because there are many patients complaining of lack of sleep and so many are not participating in their therapy. The study is for the benefit of the rehabilitation patients so that they may be able to reach their goals to the fullest potential. The study will also be of great benefit to the hospital, the employees, and to future patients, as we'll be able to fully understand and educate others on the importance of sleep and the impact on the patient in the rehabilitation unit. The patients are our #1 priority, and they will be actively involved. The main outcomes is that we will be seeing patients participating more in their therapy, retaining the education that is given to them, and reaching their full potential goals. Let's move on and discuss the prior research that was found on sleep. Now, I found a lot of information on sleep in general, but not a lot of information was tailored to the rehabilitation patients. So I felt that there was a couple significant and closest to being related to rehabilitation patients, and I'm going to read that to you. So the authors, Minosha, Sandkeller, and Ware, of Sleep Problems, Health-Related Quality Work Functioning, and Healthcare Utilization Among the Chronically Ill, states that the elderly are reporting that they are having trouble obtaining 8 full hours of sleep at a time. Sleep manifests issues within itself through activities of daily living, which in turn causes difficulties with learning, cognitive, and memory concentration. Many rehabilitation patients have long-term or chronic health problems, and the disruption of sleep tends to actually exacerbate those problems. All in all, what they're saying is that sleep deprivation can cause disruptions in a patient's medical course of treatment. The next article I found came from the American Occupational Therapists Association, or AOTA, and was wrote by Tester and Foss. It is called Sleep as an Occupational Need. They especially encourage routine screening of patients' sleep and to look for factors that could be causing sleep deprivation. AOTA reports that poor sleep is a frequent medical complaint that often associates with those who are impaired neurologically. In fact, sleep should also be considered a part of the patient's activities of daily living. That was a lot of information to cover. Next, let's discuss the standardized tool and the kind of research that will be used to collect the data. So according to Ranley, Sanborn, and Tang, in what sways people's judgment of sleep quality, the use of both qualitative and quantitative research can be used to collect data on sleep. Qualitative data is the research that will collect data from patients in which physical and mental capacitations and how well they slept. Example, light, average, or deep. Quantitative data uses observational data such as how they slept and the amount of therapy time that was reported by the patient. So we're going to use a standardized sleep tool that's used by the healthcare team, and they can evaluate their individual patient's sleep reports by that. So the sleep tool I've chosen to use is in the form of a questionnaire. Questionnaires have been used successfully in patients with both physical and mental limitations, per Drs. Ramley et al. The most important outcome of the questionnaire survey is that it collects the self-report from a patient and it is considered to be the most accurate. So, here in front of you, there are copies of the questionnaire survey that will be presented to the patients. As you can see, it has 10 questions and it is multiple choice. The nurse will instruct the patient to use only a pencil, and we will obtain information and informed consent from the patient. The nurse will then explain to the patient that they will have until their first therapy session to complete this survey. They may choose to opt out or complete it. Please note that it will not be done, and it is only done randomly in even-numbered rooms. The nurse will then collect the surveys and keep them in a specially marked folder at the nurse's station, where the researcher will then collect them in the evening, and they will use an Excel spreadsheet to keep all the data in a chart for each day that it's taken by the patient. So, we're going to do a little demonstration. Jennifer, can we do a demonstration here?
Absolutely.
Okay. So, let's see your survey here. So I'm going to take it. Hi Jennifer, how was your night last night?
Good, how are you?
Oh, all right. My name's Courtney. I'm going to be your nurse today.
Okay.
I'm going to ask you to fill out my inpatient rehabilitation sleep questionnaire survey. It's 10 questions, multiple choice.
Okay.
And I would like for you to only use the pencil,
Okay.
as if you decide or you want to change your answer, it's easier to do that. You'll have until before your first therapy session to complete this for me. If you choose to opt out, you can let me know when I come pick it back up. Okay?
Okay.
All right. So, we have finally made it to the end. Let's recap. As you can see, it is important that we help current and future patients in the rehabilitation setting achieve their goals. The proposal was designed in an effort to promote the participation in therapy by researching the amount of sleep that is needed. It was chosen specifically for rehabilitation patients, and it is very rewarding to see my patients reach their goals.